Tell me what is going on.
All right, so I ran an ultra back last week of March.
Already crazy.
My calf wasn't firing.
Okay.
My hamstring wasn't firing. My glute wasn't firing, all on this leg. So whenever I wanted to stabilize, I would even be running on concrete and I'd buckle. Even right now, if I'm standing like this,
yep,
this is fired up. Like,
don't stand towards me, face me the other way. There you go. All right.
I think a lot of my problem is in my feet.
You're right.
I have flat feet.
Turn and face that way, please. So what I look at first, okay, is that, well, first of all, your right quad is way bigger than your left quad is.
Interesting.
And you pronate big time, so your feet are falling in, and that's always, right? That's,
yeah, always.
You know, no pain, fasciitis, no issues that way.
No.
Can you give me a little itty bitty squat? Right there. Now, can you put the weight without the ground? Can you put the weight, keep the toes down, on the outside of your foot, on both of them? So you feel how that makes these muscles contract?
Yeah.
Okay, these muscles have to kind of work to make this muscle contract. Now, do you feel it in your glute?
Yeah.
Okay, so when you're standing, you're generally pronated and you're putting all of the weight on the medial aspect here.
Got it.
And you're not using these muscles. And these muscles are vital for you, especially on a, let me guess, a terrain type run where your foot isn't able to hit the ground perfectly flat. You're hitting it with a rock or stick or whatever, constantly pulling this in and creating this almost not chronic, but acute kind of strain.
Yeah.
All right, so let's have you face the front. And you've never worn orthotics, you've never...
I used to do orthotics. Now I have like those are really expensive, so I don't do the custom orthotics anymore. I just do the basic orthotics.
Okay, custom orthotics are more expensive, but it should be because you're casted non-weight bearing in the perfect position.
Got it.
So that we can create it. When you stand on it, it's giving you an orthotic to support your foot of where it is in position.
Got it.
So it doesn't mean it's bad, it's just a different way of doing it, okay? So let's have you sit right here. Good, and then I'm gonna have you kick this leg out perfectly straight and pull your toe all the way up. Does that hurt in the knee? Nothing now. So the knee pain has kind of subsided.
For the most part, yeah.
All right, and then we're gonna relax. Let me see the other leg kick up. Good, and then kick this one up again. Don't let me push it down. Any pain when I do that?
Not totally.
And hold it here. Don't let me pull it. Any pain? Okay. Put both of your fists between your knees. Good. Can you windshield wiper your lower legs? Keep these together. Don't let that come apart, but open your legs. Does that hurt?
It definitely fires this up.
Okay.
I had I don't even know what it's called.
Arthroscopic for the ankle?
Yeah.
To clean it out from having a bony fracture. Got it.
Yes.
All right. Let's have you lay on your back, please. Right there. Perfect. All right. So we're just going to take a look here. So what I want you to do.
So right there.
You feel it immediately.
It's right up in here.
Okay.
And it's just
firing.
Yeah.
All right. And in your history of knowledge, do you have the same leg length?
I don't know.
Okay.
No idea.
Make a muscle. I want you to push your knee down into the table so it contracts this muscle. Anything hurt when you do that? All right, and do this one. Awesome. And then relax. Can you do this one again? Okay, good. Ideally, when you go see someone, you want them to look at how does the knee actually move and compare it to so-called the good one.
Yeah.
You've been running for how long?
4 years.
4 years, okay. And your knees, lots of clickies and movements and things like that.
Yeah.
And of course, we just look to see if any of the ligaments are torn, if everything's moving okay. And we test to make sure that everything moves. You have a very laxed, but very still together knee.
That's
You're not gonna love this one. So sometimes, I know in my life, I ran a marathon and felt fine. Were hurt maybe from 18 to 23.
Yeah.
And then it hurt for a whole lot of time afterward. And you can create some meniscus tears. You can irritate a ton of the muscles on the lateral aspect, the medial aspect. Your glutes, their bursas, all those kinds of things can be irritated. depending on the terrain, how you move. You don't have a ton of swelling or fluid, so we kind of look. There's not a lot of heat, so it doesn't feel like anything is torn. The ligaments are all kind of, pulling together and, they're holding you. You're not like, I can't draw you out.
Yeah.
So when we do it straight, you don't like that one. I didn't think you were going to like that. Nothing specifically is crunchy, like an itis, like an inflammation. But your IT band is definitely tight. So it runs between the quad and the hamstrings, and it can be very tight in here when we do different things. So this is where the muscle actually is. So the tensor fascia lata, okay, is right here, and it creates the muscle and then makes a tendon that attaches below your knee.
Got it.
So when you kind of showed me your picture of like the pain coming from here all the way down, that's definitely following the same pathway of the IT band, which is considered the running syndrome. Okay, so it's the muscle that is overworked. It's the only muscle that crosses two joints. It never gets a break, and it's always having to work.
Yeah.
And so people complain of pain right here in their butt, and also right here in their knee. Okay. So it's right below the knee, and then everywhere in between. So if we were able to do this and work all the way down, you're gonna feel different aspects are tighter.
Yeah.
Spots.
Yeah, that's crazy.
Now, if I bring this leg all the way across, you're gonna feel stretched now here.
Yeah.
And if I try to straighten you, yes, you're gonna feel.
Yeah, that'll fire up.
So there's where the IT band is. Here's that same muscle. Here's the muscle.
That hurts like.
And this is the glute back here.
Yeah, that really hurts. All that hurts.
When something's tight like this, the skin is actually attached to the fascia below. So it makes it even tighter every time you kind of try to move. It's why it feels better when your knees bent or both bent or half straight.
Yeah.
Because the fascia, think about a piece of chicken. When we take chicken out of the refrigerator, we usually cut off that white stuff. That's fascia. And your skin right now is attached to the fascia, which is attached to the muscle. And so it's all tight and bound down. So when you try to use it, it probably feels like it's ripping or giving away, and it caused pain. So it also has caused inhibition, meaning shutting off of all of those muscles. So that's why I keep asking if you can do a quad set by pushing that knee down, because that's telling the muscles, oh, we have to work again. Because when it hurts, we turn it off. When you said that your calf wasn't firing, your hamstrings aren't firing, well, we can turn those muscles on. So if you were gonna do a hamstring isometric, you're just gonna bring your foot up like this. You're gonna try to pretend, exactly, you're pushing your heel down and back, but there's no movement, but it grabs this hamstring.
And it turns it on.
And it turns it back on. And you gotta do that periodically through the day. You can do it seated, you can do it laying down. I can do it standing, any which way to just try to pull and turn the hamstring on so that
it's more mind muscle that you have to like retrain.
Yes, you have to, but it's caused because of pain. Pain, physiologically will shut off any muscle below the area of pain. So when you have it, it's called inhibition. So it hurts. I've injured, irritated, created inflammation, done something, shuts the muscle off. And so we have to turn it back on. And the reason why people, I don't really hurt, but then you had some pain unconsciously, it shuts everything off. A week later, 2 weeks later, why does my leg not work? And so it's so vital that you have to constantly turn it on. And it takes a little bit of time. If you had 2 weeks where none of things worked, you can't magically just assume that you're going to go run and have the ability to have endurance or distance because the muscle's only working half.
Got it.
Does that make sense?
Yeah, totally.
And then you're going to look at your flexibility, of course, because you're going to work both sides of the muscles.
So this is where actually I do a lot of yoga, but with this hamstring specifically right now,
you haven't been able to do it.
There's not the same range of motion that I like at all. Like even trying to reach down, my heel comes off the ground, which is wild.
Yeah. So the thing with muscles, they're kind of great. They'll protect the other side.
Got it.
So every time you're supposed to do something for, think about sit to stand, okay? It's supposed to be a quad thing, but if you go really slow, you can actually work the quad then separately instead of making the hamstring work.
Yes.
Just kind of plop down and sit. Well, you just didn't use any muscle. But if you go really slow, you have to engage all of these muscles to work again. So it's just trying to make sure that everything is working together. It's supposed to be synergistic. It's supposed to be that if this contracts, this is protecting so that you can't go too far.
Yep.
And your hamstrings are very angry. While you continue to run, I'm going to guess that your lateral side really hurt and you kept running by kicking your butt a little bit, your heel a little bit more towards your butt to
100%.
engage your hamstring so that you had the ability to power through and finish the race. Probably should have stopped because now we have to deal with an injury, but we don't ever do that. So, but that's kind of what we want to look at. And how does that feel? You are very flexible.
Clicky.
Clicky for sure.
In my glutes or my hips.
And your hips, yeah. All right, so you're gonna lay on this side for a second. Now, we know that this muscle's here and it runs down to the tendon here. So we wanna try to work. I sharpened my thumb side to this. So if you work this, if you have the hypervolt, hold the hypervolt, put it right on the glutes on the side. If you're not standing on it, you're gonna get a nice massage without it. But the whole idea is that all of this fascia is gonna move. So you can see I can kind of shake it the same way that when you hold a hypervolt, it is gonna pound, but it's gonna shake and allow for that separation between the skin, the fascia, and the muscle. And that's kind of what we want. And then we wanna, of course, work the muscle. So here, right here is your hip. This is the bursa.
Yeah.
Right here is where that tensor fascia lata is, which you really feel, and it's a little crunchy. So you've got a little bit of a tendonitis in here. And so he's not gonna like this as I rub my finger across it. So it's going this way and I'm gonna go perpendicular across it to try to calm it down, which sounds horrible, but you do it for about 10 seconds. He looks like he's miserable. I don't look at him during the time. And then we stop and then we relax. And then you want to be nice to this. So how do we become nice to it? Just a smooth release or smooth release here. We're gonna check to see how tight that IT band really is. Does that, you feel that down the side?
Oh, for sure, yeah.
So the hip flexor, the IT band, all of those are a little bit tight.
Oh, man.
And that's super tight.
Yeah, really bad. Like this is all pulling like.
Exactly. So the iliopsoas is in here, attaches to the back, and that also is getting affected. So you can't mess with one and not have everything else be affected.
Yeah.
These are protecting this, and so everything right now is tight for you. Now, we're gonna just look above the joint, which is into the quadratus. That's a like either. And that's all the ability to help him rotate. So if you try to do anything, this muscle is not gonna do it. So everything else is trying to help.
And so that makes sense why all of these muscles have been on fire recently.
And I'm not a believer in resting at all, but we sometimes have to figure out a different form of exercise to still train you, but that is not the pound. So an elliptical right now would be good. A bike, yes, but being careful on mindful of how you get on and off the bike, because that affects the pelvis and the hip and how you're sitting if you're on a spin bike or a Peloton versus like a recumbent bike with a nice big fat seat.
Yeah.
So that does make a difference. So I'm just trying to release all of these because you're also unlevel, your alignment is off, so we're gonna fix that as well. But right now the muscles would be holding you too much, so you have to kind of release them to relax it, to make it so that it's a little easier.
You guys definitely need to get this work done and play that march. Don't be in my shoes. Also stop.
It's a thing called stop. We only learn this as we age, so don't get me wrong. When I was 30, when I did my first marathon, I ran the whole damn thing and it hurt forever afterwards. I have gotten smarter.
Yeah.
I now stop. I did a race, I don't know, a couple years ago and it hurt in the middle of that. I was like, okay, I'm too old to go through this again. So I stopped and walked to the end and then, didn't hurt as bad. But the key of it is having someone who works on you continuously. If you are training for a 50, you need to have someone working on you weekly to make sure that this doesn't come up. If you can't do weekly, at least monthly, or use the hypervolt, get it in there, get these muscles to relax, do them laying down, do them standing, do them in the way that you have discomfort. You're gonna lay on your back next. I'm gonna put your alignment back in. So this right hip is jammed up into your entire area here, which is why it's been on fire for you.
That makes so much sense.
Okay, so lay back down. So we're gonna fix that up for you. Push your foot into my hand. Good, push, 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 and then rest, and that's hard for you. So when I do an alignment, I use your muscles, so muscle energy technique, and I can always determine when you finally get put back in position because your muscles will actually engage and kick in. Versus right now, I'm like, yeah. Push again into my hand. There we go. Now we got some more strength. And you have to breathe and rest. Don't turn red. All right, and push one more time. Good, and then relax. And then on this side, we're going to actually do the opposite move. So you're going to pull your knee to your chest.
Okay.
Good. Hurt.
Yeah.
Yeah. And then pull your knee to your chest.
Whoa, that's just...
And there's this cramp because it just turned back on.
Wow.
And pull your knee to your chest. There's a strength. And then one more. Good. Now bend this knee, bend that knee. All right. And squeeze together. Yeah.
Wow.
So this is the pubic symphysis going back into pudendrift. And then
I just felt it pop
back in.
Yeah,
and
that's
squeeze.
Crazy.
Squeeze. Come on, give me some strength. There's your muscles.
Oh.
And then open. Now, did that kill you to squeeze on that last one?
Not as hard,
Right,
no.
Try it again. Better, not as painful.
Not as painful.
And open. All right. And then we're going to bring those legs back down. All right. Now you're going to squeeze your butt like you have a $1,000 bill. Oof, and then relax. And then squeeze. Better. And then relax. Give me one more squeeze. So right now, your right finally is contracting better than actually your left.
That's
okay.
good.
So your left glute is kind of like, but I would expect that because you're right-sided, you're right dominant. So that's good. All right. Now bring me your hands, come back up, and look, nice and level.
Wow.
And kneecaps level as well. All right. So let's have you turn and face that way. And then I'm just going to work this glute. Now, your posture's horrific, and that doesn't matter.
Do you think a lot of this can be a problem with like sitting a lot too? Like,
so sitting's definitely the new smoking, and it shuts the muscles off more. So I always tell people at least 30 minutes when you're really hurting, get up. Also, when you're sitting, every time the phone rings or you get a text, squeeze your butt. Now, if you squeeze your butt right now, squeeze your cheeks. There you go. See how your whole body rises up? If that doesn't happen, it's asleep again. And it will fall asleep if you sit for too long. The second thing you want to do is work the quads. So kick your right leg out, slow and controlled, make the muscle contract, feel the contraction, hold it for 2 seconds, and then slowly lower it. So you make it a very purposeful movement pattern to bring it up, get all the muscles to squeeze, pull your toes towards your nose. There you go. And it makes all of these muscles contract. Once again, always looking to see, does it contract? Because if it doesn't, you can take the left and make it teach the right. And or you want to make sure that you keep doing it until that muscle turns back on. The glutes, the IT bands, and how you do it. So let's teach you a stretch because you're at work. Let's have you stand. You're going to face that way. You're going to put all of the weight on your right leg. You're going to cross your left foot in front and put your toe down. No. Put it on the ground. There you go. So I'm going to face you.
oh, right here?
There you go. So you're like that. Perfect. Yep. So I'll do the opposite of you. Raise your arm. Stick your butt out.
Oh, there it is.
Oh, there it is. Now, that's going to get more of this muscle. To get truly the IT band, come back to center. I want you to stay in the same position. Stick your butt back first. Not that far, just a little. Then raise your arm. And then push your hip out, and you're going to
there it is.
Even more.
Yep.
So the trick is the butt out, then over. And then if you need more, elongate by raising your arm. And that is an IT band stretch. Now, the key of it all is you can't do it fast. So if you're going to sit for 10 hours, you've defeated the purpose. So every 30 minutes, you got to get up. If you're sitting, you're squeezing your tush, you're kicking out your leg at least every 30 minutes, and especially right before you get up.
So like movement snacking.
Yes. Every time you get up, you want to move some aspect that has been bothering you. And then that is your IT band stretch. Now, it's not comfy. So that hypervolt I was talking about, you can put all that weight and put the hypervolt right on that muscle in that position, and it will really work. So the leg that you're stretching has all the weight, and then the opposite leg.
And then right here.
And then you work that whole entire muscle with that hypervolt. And you can just leave it in the same spot or do it.
Okay.
And that will help to relieve that. Now, your butt hurt a lot when you first sat down. So sit and see if it still hurts a lot. Good.
No, it actually, when we did that resetting,
Yeah.
I felt the immediate. Yeah, that's crazy.
And then we now just have to stretch your IT band. Now, when you stand, make sure you have weight on the outside of your feet, keeping your feet flat still, but make sure you're engaging all these lateral muscles that you're not using, which will then turn the glutes on for a regular time so that now you'll have engagement.
So before this,
Yes.
it was, yeah, exactly. That's insane. That's insane how quickly that can happen.
So it can happen that easily. So it's quick fixes. It's just figuring it out, but you have to keep with it now. So now you got to keep those muscles turned on, keep stretching it. And now when you go to run, start with a slower pace, start with a slower or smaller distance. see how it feels, and then you have to wait till the next day to see how your body responded. If you go day, that will be a problem. Also, when you finish your run, when you get in your car, put your butt in first. Do not step into the car because you're just going to irritate that entire right side that you just did, that's exhausted, that just ran, that had all these problems. You want to make sure that you put your butt in first. So as I say, sit into your car like a little old lady, put your butt in first, and then both legs, and keep them together so that your hips and your pelvis don't shift.
Wow.
Okay.
Really good what you do.
Thanks.
That's awesome. So takeaways, make sure I'm movement snacking.
Movement snacking.
Get worked on it, like with the hypervolt.
Yep. You can work on it yourself. You can get someone to do it for you. A good massage therapist, a good physical therapist. That's what we're meant to do. Is you don't always have to be hurt to see it, but to see us on a regular basis, to know your body, we can put you back together again and stretch the right things. And then one day we'll talk about shoe wear. If you enjoyed this episode, please keep coming back for more. We're going to do every body part, every injury, and let you know how I treat them and what to do to quickly fix it.